Hello, I'm Dr. Kathleen Berchelmann, a pediatrician, a mom, and the co-founder of My Catholic Doctor. As a pediatrician, I've worked with countless adolescent girls, and I've seen how understanding one's body can be both empowering and medically beneficial. When young women experience issues like irregular or painful periods, heavy bleeding, or acne, hormonal contraceptives are often prescribed as the first and only solution. While these medications may mask symptoms, they frequently don't address the underlying medical causes of these symptoms. What many young women and their parents aren't told is that hormonal contraceptives carry significant risks, particularly during adolescence, when their bodies are still developing. These risks can include depression and mood disorders, which studies show can be particularly pronounced in adolescents. Blood clots, which although rare, can be serious or life-threatening. Decreased bone density during a critical time for bone development, which can lead to bone fractures. An increased risk of developing breast cancer, cervical cancer, and certain autoimmune diseases. Masking symptoms of underlying conditions, potentially delaying proper diagnosis and treatment, can have impacts on future fertility. Cycle charting, also known as fertility awareness or natural family planning, when used in adults, isn't just for preventing or achieving pregnancy. For adolescents, it's an invaluable educational and diagnostic tool. By teaching young women to observe and record basic biomarkers like menstrual bleeding patterns, changes in cervical fluid, basic temperature readings, and associated symptoms like cramps, mood changes, or acne flares, we give them an objective way to understand what's happening in their bodies. This information is not only empowering, but provides valuable diagnostic data that can help identify underlying medical conditions. Let me give you a concrete example. Consider a young woman with severe acne who might typically be prescribed hormonal contraceptives. While this might improve her skin, it merely masks symptoms without addressing potential causes. With cycle charting, we might observe irregular cycles and other signs pointing to polycystic ovarian syndrome, abbreviated as PCOS, which often causes elevated levels of androgens and progesterone, contributing to severe acne. By identifying PCOS, we can treat the actual condition with appropriate interventions, rather than simply covering up symptoms. Similarly, cycle charting can help identify thyroid disorders, endometriosis, nutritional deficiencies, stress-related hormonal imbalances, and many other conditions that might otherwise go undiagnosed. Once identified, these conditions can be treated with targeted interventions that address the root cause rather than simply suppressing symptoms. Beyond the medical benefits, teaching cycle charting to adolescents builds body literacy and self-awareness. It encourages young women to be active participants in their healthcare. It provides vocabulary and confidence to discuss concerns with healthcare providers. It creates lifelong skills for monitoring reproductive health, and it instills an appreciation for the body's natural processes. As healthcare providers, we have an ethical obligation to discuss all options with our patients, including risks, benefits, and alternatives. Unfortunately, cycle charting is rarely presented as a viable alternative to hormonal interventions, despite carrying virtually no risks. Consider this comparison of hormonal contraceptives versus cycle charting. Hormonal contraceptives include numerous potential side effects, may mask underlying conditions, use potent synthetic steroids in developing bodies. Cycle charting has no physical side effects, helps identify underlying conditions, works with the body's natural processes, and provides valuable health data. In medicine, we aim to use the least invasive, effective intervention. For many adolescents, cycle charting can be that intervention, either alone or as a complement to other treatments. At My Catholic Doctor, we believe in empowering young women with knowledge about their bodies while providing healthcare that respects their development and long-term well-being. If you're a parent or a young woman interested in learning more about cycle charting as both a health monitoring tool and a potential alternative to hormonal medications, we offer resources and support through our network of faithful providers. Remember, understanding your body isn't just about reproductive health. It's about overall wellness, empowerment, and making informed healthcare decisions throughout life. Thank you for joining me today.